Thanks for joining us, everybody, for today's PlanYear Employer Series webinar entitled Managing Benefits Communications with Remote and Hybrid Workforces. My name is Colin White. I work in marketing for PlanYear, and I'm joined today by Tariq Hilaly, who's the CEO of PlanYear, and Molly Presson, who's the VP of Commercial. We'll be getting going in just a moment here, but before we get started, I'd like to just go through a few housekeeping items. First of all, we are recording today's presentation, and we will be sending a link to the recording to everybody who attends within the next day or so. So keep an eye out for that in your email. The other thing I want to mention is we are able to take questions. So if you have questions at any time during the webinar, please feel free to use the Q&A panel. And we will definitely answer questions at the end, but also in stream if necessary. So please use the Q&A panel to enter your questions at any time. So without further ado, I'm going to pass it over to Molly.
Thank you so much, Colin, and some quick introduction. So I am joined by our CEO, Tariq Hilaly. Tariq is the founder and CEO of PlanYear and previously was the founder and CEO of Lumity. So he has a wealth of experience in the brokerage industry as well as benefits communications.
Nice to be here. Okay, so let's start out. I think one of the important things to look at when dealing with benefits communications is you kind of have to look at how we got here. If you go back to the early 90s, benefits information was largely on paper. Benefits enrollment was largely on paper. Just about everything was on paper. We have made strides since then. The first major stride was the advent of the web. And desktop internet access, which was probably late 90s. And by the year 2000, we had PDFs, and benefits guides moved from being printed on paper towards being electronically available via PDFs and distributed by email. So then you fast forward probably till around 2008, and the next thing you know, the iPhone came along, actually 2007. And people started to access data on their mobile devices. So the next thing was, okay, I can access it on my desktop. Now I want to access it on my mobile device. That's great. That changed our lives. It changed the way people consume information. It changed the way people live. But what it didn't do was change the PDF, because the good old PDF remained in place. And so now you had a medium in PDF optimized for desktops being accessed a lot by mobile. Does it work? Kind of, sort of, not really very well, but it worked well enough that people basically continued with this. The next paradigm shift in technology and how we lived our lives was social. This happened shortly, probably, in the early part of the 2010 to 2020 decade, where Facebook, Twitter, and others really got to critical mass, and people started sort of consuming not only information that was broadcast to them, as was the case in the past, but they started consuming information from their peers, and they started collaborating on things, and they started answering each other's questions. And then with the advent of Slack, you had Slack channels, and then you have benefits Slack channels where employees will vent their usually frustrations, but sometimes, rarely, that occasional happiness about benefits. It does happen, but mostly questions about how things work, questions about what to do, questions about various things. And then it ceased being simply the benefits manager or the broker answering those questions, and employees started answering each other's questions. I have seen benefits Slack channels where people are talking about copay cards, for example, which are cards that pay the deductible and make a regular copay on expensive medications, even if you're on a high deductible health plan. These things can save people hundreds, if not thousands of dollars a year. And they're not really broadly disseminated in benefits guides. And so, people would come on benefits Slack channels and say, hey, I got this thing. It was great. It can save you hundreds of dollars. And then others would say, what's that? Right? All this was happening outside the purview of HR teams and brokers. And it was happening on a peer-to-peer basis. So, the way that people were consuming information, finding information, discovering information changed, yet the good old PDF persisted. The benefits guide continued to be this static document that is a PDF that is produced one time a year. It's emailed out. It doesn't change. And, it was becoming more and more outdated as we go, simply because they could get a broader range of questions answered in a more timely fashion through these media like mobile and social. And the PDF really wasn't suited to that. Now we go towards 2023, and what's coming next? Well, it is the advent of ChatGPT. It is the advent of AI. Most benefits questions are not that complicated. There are some that will always require human intervention, like, claims issues, which require peer-to-peer reviews and things of that nature. That will always be there. But a lot of them are fairly basic in nature because employees don't really understand benefits. No surprise, really, when if you think about it, the primary education tools were a broadcasted open enrollment meeting that is a once-a-year event where you're supposed to sit politely and consume information. At best, you can line up at the end and try and hope you can talk to the presenter and ask them a question and hope that your coworkers don't overhear what you're saying, right? That's one avenue to education. And the other is the good old PDF that continues to live on. Well, the world is moving on. And pretty soon, AI bots, chatbots, as it were, will be able to answer the majority of these questions. They will be able to do it on a 24/7 basis. The one thing that particularly social and chatbots have in common, and mobile helps accelerate, is the concept of interactivity. The concept of, I don't have to sift through everything. You don't have to talk to me and tell me everything for me to find the information that I want. I want to be able to request it and get an answer, and I want to get that answer when I want to get it. That is where benefits communication needs to be. That is where technology has taken us. But the good old PDF lives on. So guess what? No surprise, it isn't working so well.
Yeah, and I think the only thing I would add to that is the remote and hybrid world has only exacerbated this, right? We have this evolution on the technology side. Folks were living in a virtual world, and we all took advantage of that throughout the pandemic. Well, office environments moved to hybrid and remote work. And unfortunately, with things like a PDF benefit guide, that only made benefits communication more challenging.
Yeah, and even in media like open enrollment meetings, I mean, honestly, people want to be kind of sitting at their desk, probably doing something else with the ability to come in and come out as they go. One of the things that in a hybrid world is that the attendance at open enrollment meetings has skyrocketed relative to the pre-pandemic days where we used to do a meeting in a room. We would be in a, let's say, 200-person company to get 25 people in that room. Now, you're getting 40, 50% of the company showing up to this. Now, I don't suppose they are sitting there riveted with their, cost, paying impeccable attention. But what they're probably doing is sitting at their desktops, right? Doing something else, keeping one ear on this, and then zooming in on the pieces that they actually want. Because they now have a media where they can do that, the actual participation is going up. But more importantly, they're actually getting the answers to their questions more effectively. And since we do primary employee support for a lot of our groups, we are seeing a meaningful reduction in the number of questions, especially obvious questions, since we've gone to this virtual hybrid type media.
Yeah, it's almost like, virtual was a benefit in terms of benefits communication. It's really an opportunity if you seize it. So, with that in mind, we've obviously seen this pretty big shift with hybrid, virtual, remote work. How do we drive increased engagement in benefits program with that in mind?
Well, the single biggest thing is technology, right? It is absolutely the key to doing this. Now, if you think about hybrid/remote, and at this point, most, I would say, if not all tech companies, as an example, but are probably either some form of hybrid or remote. Even if they're in office, probably 5 to 10% of their people will be distributed all over the place. The nature of the scarcity of talent and the increased mobility in the workforce, and more importantly, the market forces around that. And I know that we are in a period now where there's a lot of downsizing going on, but for top tier tech talent, they will always have options. And increasingly now the standard is they want to live where they want to live. And even the most adamantly in-office companies will make exceptions for people they deem to be exceptional. I mean, it's just good business to do so. And so we are all, in the tech industry at least, pretty much either, some form of hybrid or remote. It's just a matter of degree. Even in other industries, they almost all have some remote workers around the place. And interestingly, many of them, though they have gone back to the office, still are using technology and some of the remote/hybrid tactics of the pandemic in their communications, because they realized that the engagement and the outcomes fundamentally were better. So just because you're in office doesn't mean these technology media don't work. But the first thing you have to recognize when you're dealing with technology and benefits is that the term benefits administration systems is actually a bit of a misnomer. They are benefits enrollment systems. And really what they do is they put 4 boxes on a page and they encourage you to pick the box, which is the plan, that best suits your needs. They are very good as transactional processing systems if you configure them correctly. And I know that that's harder to do than scribes, and then connecting them to the insurance carriers is even harder still.
That's a whole nother webinar.
Even if you get that right, you have to understand what these things do, which is they process a transaction. I pick a plan, I get them enrolled in the plan, and that's what I do. What they don't do, importantly, which relates directly to this, is they do not educate people on those plans very well. They do not help them navigate to the right plan for them. And so, you have the basic onus of benefits communications still falls on the trustee PDF, and Ben admins, or benefits enrollment systems, if you want to call them that, in no way solve that problem. So what do you have to do? Well, you have to pair your transaction processing system with some sort of a system or plan to actually educate your employees. Now, I get asked a lot, well, what is the best Ben admin? And generally speaking, there are many that can do the job if configured correctly. The best one tends to be the one that will integrate seamlessly with your HRIS and payroll system, assuming they can build EDI feeds, but that's a different issue. That tends to be the best Ben admin. But even the best of Ben admins do not help you actually educate your employees. So what is it that the employees want? Well, during enrollment itself, what they really want is a tool that will help them map their basic anticipated needs, right? Keep in mind, healthcare is the combination of 2 things: prepaid healthcare, which is stuff you expect to happen, and then tail risk, which is stuff you don't expect to happen. Health insurance is unique insofar as it is the one form of insurance that you have that you expect to use every year, right? So let's think about this. I don't know if my tail risk, my tail event, like I get hit by the bus, is going to happen, but I can figure out what my maximum liability is through an out-of-pocket maximum, which fortunately is somewhat intuitively named. So therefore I get that part. But how do I map my basic expected needs for my family to the plans to understand which would be the best one? That is actually much harder than you may think, because these plans, perhaps intentionally, are designed by insurers to not be terribly intuitive. And they are designed to pass as much cost on to the consumer as they can without making it completely obvious that that's what they're doing. Again, I don't blame them for doing this, but it surely makes it confusing to employees and expensive if you get the wrong plan. So the first thing is they need plan recommendations, tools that help them figure it out. What can those be? They can be tools where you can put in your basic needs, and then they will map that to the plan structure and the costs to generate a cost estimate under the different plan types. The second thing, and again, we know this because we did employee support on the Lumity side, was they want simple things, like they want to be able to look up their providers and see if they're in network. You'd think they could do that on the insurer side, but you need to know what the network name is. Is it Choice Plus? Is it Select? Is it Select Plus? Is it this? Is it that? They have like 15 different networks. By simply having a site where you can actually tell them which network to put in and then give them instructions on how to look it up, we cut the employee calls by 50%. 50%, right? A very simple use case, but not one that a PDF can actually accomplish, right? Yeah. So that's kind of an example of that. Embedded open enrollment videos. Okay, why is it that historically an open enrollment meeting happens at a point in time? If you happen to be there, great. And if you don't, guess what? You don't have that help. New hires historically have struggled, or HR teams have to do special open enrollment onboarding mini meetings for them, which is incredibly inefficient for the HR team, right? And ultimately isn't helpful to the new employee. Why? Because if you actually embed the open enrollment video, you can do two things. One, you can make it available throughout the year. That also applies to employees who may be making their choices on the last day. None of us have ever seen that before, but historically, I will tell you, 50% of employees pick on the last day. It doesn't matter whether you make open enrollment 1 week, 2 weeks, 3 weeks, you can make it 3 months. It wouldn't matter. Half of them will do it on the last day, sitting on their couch with a loved one. What do they really want? Well, one, they want it to be available asynchronously, right? Who the hell wants to have to sit there at a time of someone else's choosing when I can just click on a button and watch it at a time of my choosing? And the second is perhaps related to that. They want to fast forward someone like me to the place they want to be at, right? When I actually do open enrollment meetings, I have to basically assume that I'm dealing with people who don't know much. And you kind of have to build that picture from the ground up quickly. For many, they know some things, they don't know other things, and they want to just get to a certain part. For example, their issue is spending accounts. Well, guess what? You can't get to the ins and outs of FSA versus HSA until you've laid the groundwork with what's changed, what's the medical, what's the dental, what's the vision. They don't want to hear all of that. They just want to get to spending accounts to understand how do they work. Well, guess what? Zooming up or fast forwarding on a little dial at the bottom of the page, that's what they want. Final part, in the historical sense, open enrollment meetings at the end, people who have questions or complex needs would line up. They try and space themselves. Social distancing was happening before the pandemic. Again, why? Because they didn't want to overhear their colleagues' health information. And that was always awkward and inefficient. Some people would stand there waiting for 45 minutes, just trying to get their question answered. Okay, so what's the right way to do it? Well, guess what? Click on a button within the benefits guide, which if it's a website is interactive, open up a calendar link it to a video, and then get a one-on-one consult with a benefits expert at a time of your choosing in complete privacy. Right? No waiting, no overhearing, none of that. When I need it, I can get it. That is the paradigm that people want. So, again, if you look at it, all of this sounds very obvious when looked at through the lens of how we live our lives, but none of it is really well suited to what 99.9% of the world is doing right now, which is giving you that good old PDF and saying, you know what, I'll email it to you, and after that, you're on your own. It's no wonder that employees don't understand benefits particularly well. So education is absolutely important, but done the right way. So what does modern benefits communication look like? Well, they want to know about all their benefits in one place, right? The days of benefits are just medical, dental, vision, life, and disability are over. The insurance carriers have stripped out so many things. A good example is mental health. Notionally, they do provide some mental health support. Practically, it is hard to find and pretty hard to use. So what's happened? Well, what's happened is the kind of unbundling of benefits, right? You now have different mental health vendors, different financial wellness vendors, different this, different that, right? Well, the first thing is, if all of those things are separate, and unfortunately from an app perspective, many of them are, then now all of a sudden you have a discovery problem, right? If you tell employees to go to 15 different places, they don't do it. It's hard enough to get them to go to one place, but you have a much better chance if you can make the benefits hub the place where they can find all the benefits information. So this needs to be a living resource because, the content evolves throughout the year. Benefits programs run correctly don't roll out all their programs for the year at open enrollment. That is a dated paradigm. The most forward-thinking benefits managers are actually rolling out different things throughout the year. Well, in order to do that, again, a static PDF where you have an installed base in people's inboxes can't accomplish that goal, but a dynamic website can. So you definitely need it to be evolving. Things happen during the year. You have notifications going on. They change spending account rules. The pandemic has made this much more severe in the sense that they were changing rules on the fly. You need to be multi-channel. You've got to have a mobile app. You absolutely have to. People are looking for this stuff frequently at the point of sale. You can't bring your desktop to a hospital, nor is it easy to connect it up in the car. But guess what? They pick up this device and they want that information, and they want it to be easy to find, and they want it to be easy to use. They want tools like the doctor lookups. They want tools like ID cards with their member IDs that they can easily access. They want to be notified if things change, right? Which requires push communication. I would like to see anyone, or I would challenge anyone, even Adobe's most ardent product managers, to show me how you can push information to a PDF. Because as yet, I've tried. I haven't figured out how that's possible. But again, if you have a mobile app, it's actually very easy to be able to broadcast updates and information. Social, you need to go where the people are. So many companies have benefit Slack channels. Okay, so, others will tell you, we have employee support. Okay, fine. But if you're not where the employees are, how do you have support? You've got to go where they are. You can't wait for them to come to you, right? So if you have a benefit Slack channel, you have collaboration going on between employees, you can get to quicker answers. And just to take a step forward on that, if you have AI-driven bots, you can actually provide 24/7 answers within the context of those channels. And then those answers, which aren't always perfect, but are generally mostly correct and certainly directionally correct, they can then be refined and commented on by the other employees, right? Not all advice, as I was pointing out with copay cards, is official advice. Some of the best advice you get in benefits is through the experience of your colleagues. We collaborate on everything. Slack channels tend to be, some of the foundational pieces now of modern hybrid enterprises. And guess what? That's where the benefit stuff needs to be. And then the final part is they want 24/7 availability. If the technology exists to provide it, we need to provide it. The only reason we haven't historically is it's been cost prohibitive if humans have to staff all of it. But if AI can handle most of these things, and it already can, it will only get better over time, then we need to move to a system of 24/7 availability, because that's what people are used to increasingly, and that's what they expect.
Yeah, I think that's exactly right. The evolution of benefits communication has led us to, I think, a much more virtual friendly environment. And we've talked about that kind of in theory, but let's talk practically about when and how you actually deliver these benefits communications. So the first thing that I want to talk about is adding a new benefit. I think for a lot of folks, the temptation is to actually add that benefit at the renewal. You can announce it during open enrollment. You already have planned benefits communications. But the downside of this is that that new benefit is going to get bogged down by all of the other benefits communication that's going through. Employees can only handle so much information. I think that was true in an in-person environment. It is certainly true in a virtual world where they can scroll and fast forward. So do this outside of open enrollment when that new benefit is available. The other piece of this is it is way easier to implement this one by one outside of open enrollment when you are not dealing with the busy renewal season. So do yourself a favor, don't wait until open enrollment. Add the new benefit as soon as it's available. The other piece, go ahead, Tariq.
Additional note to that allows you to engage throughout the year, right? This is compromise saying, it is true, everyone is slammed at open enrollment season and getting anything implemented is 10 times harder. But that is not the reason to not do it at open enrollment. It is only part of it. You will have a better experience, that is true. But the bigger issue is it allows you to be adding things and working on things and engaging with people and showing them that you care throughout the year, as opposed to at this singular point in time, which is open enrollment, which happens to fall right around Thanksgiving when people really aren't paying a whole lot of attention to it. Second point is, any benefit that you're adding because you think people need it. Why would you wait 6 months before you add it? It really doesn't make sense. There's no reason to. If you have the right communications media, you can do this whenever you want to. And it's actually better to do it at that time.
Yeah, break through the noise. And you create almost this, feeling that they're being supported year round, right? Not just once a year. The other thing that I would add when you are introducing any new benefit is to utilize champions. And what do I mean by champions? So when you are using a third-party vendor, when you're introducing a new solution, such as chronic disease care, mental health care, have one of your employees actually do a trial run of that and be a champion to introduce it to your population. Why is this helpful? Folks trust their colleagues, right? They don't necessarily trust a salesperson at one of these third-party vendors who's coming in and saying, hey, this is so great, you're gonna love it. They want to hear the true experience from someone that they know and someone that they trust. The other piece of this is that it allows you to do a trial run of that new benefit. So if there's any feedback that's needed for that vendor or any kinks that need to be worked out before you introduce that to your population, a champion is a great way to have that happen before it goes out to your whole population, before you make that announcement. And then you have to deal with the onslaught of questions that come if there is some sort of hiccup on that end. So utilize champions, ask your third-party vendors to actually let someone do a trial of that service prior so that they can speak to their experience and so that you all get a sense for what that is and can provide some feedback before it goes live. So we talked about adding a new benefit outside of open enrollment if it's ready, but what about during open enrollment? Obviously, this is a really kind of critical part of the plan year. So a couple things to keep in mind here. We've talked about this quite a bit, but employees want on-demand information. They want to get the information when they are at that point of decision. The point of decision these days is likely going to be on a couch. It's going to be probably after hours. And half the time when you are scheduling an open enrollment meeting, you've got recurring meetings that are blocking that. You've got a client call that they can't miss. They're not going to necessarily be able to attend, let alone engage and be paying attention at that critical time when you are discussing the information that's relevant to them. So record the videos, make them available to them, tag them in the different sections that folks can fast forward to the information that's most relevant to them. That's where you're going to get the most engagement and folks are going to make the most sort of informed decisions about their healthcare. The second piece here is privacy. Benefits, questions, benefits related information is incredibly, private to these individuals, to their families. And so it actually takes quite a bit for them to even ask a question, let alone to do that in an in-person environment where you have a group of your colleagues all around you. Tariq was mentioning the traditional paradigm where you have folks lining up and they're trying not to overhear sensitive information. It's not a good system and it doesn't encourage people to ask the important questions that they need to. The more sensitive the information, the less they're going to want to actually ask that question. And those are the folks who need to be asking. So providing virtual consultations on a one-on-one basis keeps all of that information private and secure, but allows them to ask the questions that they need. So one-on-one virtual consultations can really, really push the information out to the people who need it the most in a way that they feel very secure. The last piece here is mobile. Inboxes these days are absolutely insane. We've discussed the utility of using things like Slack channels. Even if you go to some of those Slack channels, you might have someone who has hundreds of notifications that they have not seen yet. Mobile is a much less crowded place. And with open enrollment, this is one time a year. You are not necessarily bugging employees on a daily or weekly basis. This is going to be one time of year where they're getting this information. So mobile is actually a great place to push that, where it's going to cut through all of the noise that exists in inbox, in other Slack channels or Teams environments, and you're going to find your way to employees when they need that information the most, when they're making those critical decisions. So outside of open enrollment on an ongoing basis, we talked about the importance of making sure that you're available throughout the plan year, not just at open enrollment where you've kind of put all of that benefits related communication. There is a utility throughout the plan year of keeping that line of communication open. So some of the areas that I'll draw your attention to, compliance related matters. These are very timely and they need to be announced when it's relevant, when those compliance related issues come up. Reminders for deadlines to submit receipts for FSAs, hugely important. And the last piece here is also reminders to spend down unused balances. So those are use it or lose it. Employees are going to be missing out on that benefit if they don't take advantage. And you can guarantee with everything else going on in their lives that they are going to forget about this. So sending out those reminders well in advance, month or two in advance of when they're going to lose those balances, hugely helpful. And I'm sure they will appreciate that. Last piece I'll mention here is lean on your vendors to provide this content. They can provide content for emails, they can provide videos, educational pieces. So make sure you have a whole suite of benefits and vendors that you are utilizing to support your employees. So ask them to help support and create that content. You guys do not have to do it all yourselves. Perfect. So we've talked about the trends of communication. We've talked about tangibly, how do you apply this? Let's take a quick moment here just to talk about some of the pitfalls that you might run into related to benefits communication, and how do we avoid these things?
Okay, so the first thing is record the open enrollment meetings. Don't even, if you do it in person, fine, record it. In fact, even better would be to do a live open enrollment meeting where you may have Q&A, etc. But when you record the open enrollment meeting, you need two things. One, you need a place to put it. And two, you probably want a shorter version, maybe 15 or 20 minutes, and maybe not having all the Q&A in it, because Q&A, while it makes sense live, doesn't really sound great after the fact, especially if you can't ask the question. So the first thing I would say is record the open enrollment meeting, but subtle difference here, record a second one, a shorter one, and one designed for people which is not interactive, in addition to the live one where you might have a longer meeting with more Q&A. But the most important point is you need a place to put it. And again, you can't embed a meeting on a PDF, but you can on a website. And so you need something like a dynamic website to do this. You need to make that meeting available. If you pair it with an onboarding guide where you take them through the step-by-step of what they have to do with benefits, it will save you a ton of time. But more importantly, it will make for a better experience for the employee. Because no matter how much hand-holding you give someone, at the end of the day, what they really want is the ability to figure it out for themselves quickly and easily at a time of their choosing. And it is very difficult to hold hands with someone at that point, because it might be a Sunday afternoon and nobody wants to be there on Sunday afternoon, right? So it is super important to do that and not default to, well, we have a meeting at a point in time and after that you're on your own. If you do that, all that's going to happen is you'll have unhappy employees and you're going to have more questions after the fact, which will cost you more time, not less time. Second, anything you can do to offer plan recommendations and help people navigate is important. Again, there are technology solutions to this, and if combined with websites and not PDFs, that's eminently doable. But don't shy away from that. I understand why a lot of individuals are reluctant to give people definitive recommendations, myself included. However, tools that help them answer a few questions and then map to something is an achievable goal. And again, I think the reason this hasn't been done so much earlier is because it's hard to embed these things in admins and it's impossible to put them in PDFs. And the final thing is, don't rely on lining up at the end of a meeting to ask a question in an awkward silence. Have a system that allows them to set up one-on-one benefits consultations. Frequently, that is better done with the broker's team because, a lot of times you as HR professionals don't want to know about someone's private health information. If they have a serious condition and you are aware of that, and then somebody wants to let them go, it can actually cause problems. Not only is it uncomfortable, but it might even have legal issues. So, in an ideal world, you'd have a system where you can direct them to experts who are, one step removed from you. And again, technology through things like calendar integrations and video meetings and all this stuff can make that super convenient, as opposed to the, what I would describe as the bad old days of lining up at the end of a meeting. It seems very dated now. And somewhat amazing that it persisted right up until the beginning of the pandemic, and even in some cases still persists to this day. Don't overwhelm employees with information. The goal here is to proactively answer the most common questions. Yes, if I call my credit card company or my airline, it is really nice and much appreciated to be able to get someone on the phone relatively quickly. And generally speaking, both the broker community and the HR teams have been pretty good at that. But it doesn't change the fact that what people really want is not to have to reach out. What people really want and expect is to be able to navigate to the information they need when they need it relatively easily. So make sure that you have a media that is pleasant to use, easy to navigate, and answers the most common questions. If you do, you end up in this happy Goldilocks scenario of happier employees and less questions and less work. It's not often you can accomplish that, but you can here if you have the right media. Make sure you call out changes year over year. Make sure you can highlight what those things are. And again, that they're easy to find. Provide upfront summaries. People will fast forward through elements of this, right? I mean, to some extent, you have to overwhelm some people in order to build the understanding of others. And this is where fast forward becomes such an incredibly important point. And finally, people are looking not for a definitive answer on decisioning around plans, but tools to help them navigate to their own decision, which, by the way, is more comfortable for you as an administrator as well. But the big point here is it is a very difficult challenge where you have to avoid overwhelming the many in order to educate the few. And that is one of the challenges. And again, done correctly with the right technology, you can do it. It's just hard.
Yeah, absolutely, Tariq. And I think, kind of the overall takeaway that I'm getting from all of these slides and everything we've talked about today is that there is a pretty big opportunity in virtual communications for benefits. I think for a lot of other types of communication, the virtual and hybrid world, it actually made it much more challenging. But with benefits, there are a ton of advantages to doing this on demand, virtually. So taking advantage of those can actually have a huge impact on your employees, their experience with benefits, their ability to make educated decisions about their healthcare. So huge opportunity here.
Benefits are just ultimately an extension of everything else, right? Hybrid remote.
Yep.
Has generally, given that flexibility, whether you use it or not, improved people's lives. I mean, in the San Francisco Bay Area, for example, even if you're not hybrid, and even if you're still living here, and many have moved, you benefit from less traffic because in the office. So there are many positives to this. But I think the important point to recognize is there are some additional challenges it creates. And where in work, in collaboration, in all of these things, in Zooms and Slack, the pandemic has been like this giant kind of accelerant of helping people figure out how to do this. Is it perfect? No. But I think it is fair to say it has worked better than anyone thought it would, including many CEOs of tech companies who have said, I'm never going to do hybrid. I just don't see how it's going to work, or remote. But 3 years later, have acknowledged it actually worked better than we thought it would. Absolutely the key to that. So the overarching point here is you've got to recognize that while remote and hybrid is generally a positive, it does create challenges. We have done a good job of dealing with those challenges in most ways that we run our businesses because we had to. Benefits is not at the forefront of that or the first thing we think of, but the reality is those same technologies and those same approaches are desperately needed here. They just haven't made their way here yet.
Beautifully said. And I know I want to leave a few minutes for questions, but I'll take a quick pause before we make that transition and just want to share who is PlanYear? Who are we? Who is Molly and Tariq? PlanYear helps employers and brokers better manage benefits programs. Our solution gives employers visibility into their benefits program and allows them to work collaboratively with their broker right on the system. That includes features such as claims analytics, billing consolidation, and issues tracking. We also provide digital benefit guides and mobile applications to ensure employees understand their benefits, know which plans to choose, and know how to use those benefits throughout the plan year. So with that, Colin, I will pass it back to you. Are there any questions from the folks on the line?
Yes, we've had a few come in, and just a reminder, folks on the line, if you do have a question, please use the Q&A panel at the bottom of your Zoom webinar screen. I think a couple of these we've already sort of answered, but one was, does PlanYear have a mobile app? And I think you just touched on this.
Yes, PlanYear absolutely has a mobile app. Actually, has started with the premise of having everything available on on-demand websites and interactivity, and generally also on the employee side, at least there's an employer experience as well, but on the employee side, it generally aims to provide all the functionality that it provides on desktop, on mobile as well. And doing it in the form of an app actually makes that possible and easy to use for the user.
Right. Okay, we've got a couple of other questions here. So earlier in the presentation, you talked about providing one-on-one consultations. What do you do if you don't have the resources to provide one-on-one benefits consultations? What can HR department offer employees?
Well, I'm putting on my old hat, pre-PlanYear hat at Lumity now. Question. The answer is, if your insurance broker is actually doing their job, they should be ready, able, and willing to answer those questions for you for two reasons. Number one, it is a way that they can add value and leverage to the people team. Number two, it's not, there's no doubt they get compensated enough. And number three, because they should be doing it at volume, they can make sure someone is available during business hours all the time, because they can pull it together across their groups. I think the good insurance brokers offer these services to their clients. Lumity is not the only one that does it. If you have a broker that doesn't do it, I'd suggest you tell them to up their game or get.
Right. So one question came in. Are we recording this? And yes, we are recording this presentation. So we'll be sending you the recording within the next 24 hours or so. And we've got one more question here. How do you get employees to pay attention during open enrollment?
Well, okay. The single biggest, I think I would reframe the question. How do you get employees to pay attention when they need to during open enrollment? That's really the question. Again, to go back to it, making them pay attention for 1 hour, sitting somewhat in an uncomfortable chair in a room to get the 2 minutes they actually need is incredibly inefficient, and no surprise, most opt out. As soon as you make it virtual and fast forwardable, where they can be multitasking and then navigate to the place that they need, rewind, fast forward, listen to the bit that they're looking for maybe twice, it actually becomes much, much easier to get them to pay attention. Being able to push notifications to them helps them pay attention. Now you have a compelling message. The issue is not that they don't need to pay attention. Let's face it, there are only 2 times a year, most of the time, people are looking to give you money. It's file your tax return and open enrollment, right? In the one case, you get a refund most of the time. It's not like you don't pay more, but at least you get a refund. In the other case, what it boils down to is your employer is trying to give you something you really need at a massively subsidized rate. And yet, people don't pay attention. Why? Well, it tells you 2 things. 1, because it's complicated, and 2, because it's not easy. That is the point. Make it easy. Make it simple, make it convenient, and you will no longer have this problem.
Okay, great. Well, I think that was the last question, and I think we're just about out of time anyway. Thank you, Molly, and thank you, Tariq, for joining us today and providing this presentation. As I mentioned earlier, we did record it. We'll be sending you a link via email to watch it and share with your colleagues. Also, keep an eye on the PlanYear website, planyear.com, if you want to sign up to get a demonstration of the PlanYear platform, or if you want to keep in touch with our other blogs or other webinars that are upcoming, feel free to join us there. So with that, we will wrap it up. Thanks very much for joining us, and we hope to see you at a future PlanYear webinar. Thanks, Molly. Thanks, Tariq.
Thanks, everyone.